I'm Iulia Vann. I'm the Public Health Director here in Allegheny County. I just want to start by saying that it is such an honor for me to be here tonight in front of all of you. Thank you so much for coming out and being interested in the information that we have for you tonight. I think that is critical for us to be here in front of the community and being able to speak on the response, the public health impact, as well as future planning and response from my department. It's just, you know, it hasn't even been a year yet from the explosion. So thank you for all of the groups that came together to put this event. I think it's just shows the collaboration, and it shows the way that we can get so many things done when we work together, and I'm so appreciative for being here and being part of the panel tonight. So we all know that on August 11th of 2025, an explosion occurred at U.S. Steel in Clairton, which fatally injured 2 U.S. Steel employees, but also 4 other employees and 2 contractors were also injured, seriously injured. We also had 2 Allegheny County Health Department inspectors that were on site during that time. One of them was actually on one of the adjacent batteries doing the typical inspections. And he had minor injuries, and he was treated, and he fully recovered. And we had a second inspector who was on the property but did not experience any type of injuries, physical injuries. However, both of our inspectors were deeply impacted emotionally by the situation that happened and the things that they had to witness during that time. Immediately after we found out about the explosion, I had to make a very quick decision, and an alert was put out for a recommendation, a strong recommendation for anybody that lives within 1 square mile around the plant for people to stay indoors. We didn't know what was happening. We didn't know what our monitors are going to show. We just believed that out of an abundance of caution, it would be best for people to stay indoors while we're monitoring those that network and those monitors. As soon as we found out that our team reviewed the data, we, after that same evening, the recommendation was later lifted that evening, and we continue to monitor. But I believe that is really important, and I'm going to talk to you a little bit in just a little bit about our system that we're going to use to alert the community in situations like this. It is critical for us to be able to be responding in a really quick way so the community can have all of the information that they need to make the best decisions for themselves and their families. Also, after the explosion, the Allegheny County Health Department participated in interviews with investigative organizations, and we'll hear more about that in just a little bit, the Chemical Safety Board, OSHA, the Fire Marshal, and we are still conducting our own internal investigation to look for the compliance with Article 21, which is our air quality regulation in Allegheny County, and to see if there were compliance or non-compliance with permit conditions for the Clairton plant. We also looked back at the entire month preceding the explosion, where we did not observe any unusual spikes in hourly concentrations of particular matter 2.5 or PM 2.5, SO2 or H2S, that were measured at the monitor that we have at Liberty and the monitor that we have at Clairton Station over that period of time. And then we also looked at that there were no exceedances of 24 hours of PM 2.5 concentrations compared to EPA standards or 24-hour H2S exceedances compared to the PA state regulations. So when our team was doing the monitoring, I think that this was one of the biggest pieces that we're very concerned about initially, is to look at what the data is going to tell us after the failure of the equipment at US Steel batteries 13, 14. The Allegheny County Health Department conducted analysis of the monitored and the meteorological conditions surrounding the event from the, as I've mentioned, the permanent monitor sites. So we have those 2 permanent sites, which are in Clairton and Liberty. And we also brought in some additional resources. We've asked our partners at PA DEP, Department of Environmental Protection, to come and help us do some fence line monitoring, and we've also asked them to bring in a mobile air unit that will also give us some additional data on top of the monitors that we have permanently placed in those locations. We also worked with CMU, the Carnegie Mellon University, that they also have a mobile unit, so they also deployed their mobile unit with our teams. So we thought that it's not just going to be our effort in making sure that these monitors are reviewed, but that we needed additional data, and we called in our partners to help us with that. On the day of the explosion, it was sunny, we had hot weather, and that wind and the direction of the wind actually helped with the circulation and dispersion, which mixed the pollutants into the air and limited the concentrations near the ground. Winds were light and from the southwest from the first part of the week, and then they shifted direction mostly from the north on August 14 and 15. That's one of the main reasons why we did not see the level increasing of pollutants. The weather was really on our side during that time. As far as concentrations, the ACHD monitor stations at Liberty at Clairton did not measure any significant peaks of pollutants immediately following the explosion, and the team was looking at those monitors every 15 minutes, making sure that there's nothing spiking, nothing that we need to quickly respond to, and then throughout the week after that. And then we know that these types of concentrations were driven mainly by surface temperature inversions that trap pollutants near the surface, which can occur on a frequent basis. That did not happen during that week. Also, as I've mentioned, on August 14 and 15, Allegheny County Health Department and PADP conducted fence line monitoring, which means that we put monitors along the property lines of US Clairton, and we deployed the mobile air unit at 2 stationary locations near the US Steel Clairton plant. Also, we had the CMU mobile unit that was rotating in the area around the plant. During those 2 days, no immediate health risks were measured by the mobile unit, as short-term exposure limits did not exceed the United States Environmental Protection Agency levels. However, the mobile air unit measured brief time periods of concentration of air toxics such as formaldehyde, ethene, benzene, and ethylene at the fence line. However, these compounds were undetectable throughout most of the testing periods. We know that at different times there may be spikes in some of these air toxics, so they typically followed our normal data that we're seeing in any other situations. These findings could indicate health risks. However, HCHD is continuing to evaluate that data and find how is that going to be, how is that related to the explosion. It is not related to the explosion, but it continues to be a area of concern for our team. CMU's preliminary results also showed no specific hotspots that were tied to the explosion and were generally consistent with the ACHD monitoring network that we have consistently throughout the year. We will continue to review data. Our team, we have an entire team of engineers. They're monitoring the data every day. They're looking at the results, and information is always available on our website. I do want to mention the fact that our team is, again, investigating, is continuing to invest. So this is an ongoing investigation from the health department's perspective, which could potentially lead to enforcement actions. So because of that legal aspect of it, I am not able to discuss enforcement pieces. However, I do want to let the community know that our team had very direct contact with our sister agencies, U.S. Steel, our legal team, making sure that we have all of the information that we need for that investigation to happen. And lastly, I mentioned at the very beginning that we put out an alert to just out of abundance of caution to tell people to stay in, which was done through either social media and the news. Moving forward, we are July 1st, the county is going to implement a new alert system, which is called Code Red. And Code Red is going to give us the ability to quickly alert people within a specific geographic area on their phones, or we'll be able to ask you all if you are interested in receiving alerts from Allegheny County Health Department. You'll be able to sign up and receive that information directly on your mobile device.